India is fast becoming the diabetes capital of the world, just behind China. Diabetes, which used to be a rich man's disease, is no longer so. There are three types of exercises: cardiovascular exercises, weight training or resistance training exercises, and yoga. Among these three exercises, weight training has a better edge or an advantage while managing diabetes. Why? In this, we are going to talk about how to manage diabetes. Obviously, there is diet, there is exercise, but are these two fitting in the same way with regards to managing diabetes? No, they are not. And what is important, and at what stage will you bring in this diet, and what stage would you have to look at exercises, and what kind of exercise is best for diabetes? All these details is what we're going to talk about in this video. India is fast becoming the diabetes capital of the world, just behind China. Diabetes, which used to be a rich man's disease, is no longer so. Well, blame the availability of low quality food with very low nutrient density, low fiber quality, low other micronutrients, excessive amount of calorie intake, excessive amount of processed food, specifically carbohydrates, lack of physical activity, sedentary lifestyle. All these things are contributing towards a diabetes pandemic in our country. Added to this, our genetic makeup, where we are more prone towards these kind of cardiometabolic disorders, low insulin sensitivity, these all will further exacerbate our susceptibility to be diabetes. So in this, we are going to talk about how to manage diabetes. Obviously, there is diet, there is exercise, but are these two fitting in the same way with regards to managing diabetes? No, they are not. And what is important, and at what stage will you bring in this diet, and what stage would you have to look at exercises, and what kind of exercise is best for diabetes? All these details is what we're going to talk about in this video. Now, diabetes, there are two types of diabetes broadly: type 1 and type 2. Type 1 diabetes is when the body is not producing enough amount of insulin, and insulin is a very important hormone which facilitates our body's ability to uptake glucose from the blood into the cells. Type 2 diabetes is when the insulin is there, body is producing enough amount of insulin, but body is still not able to uptake this glucose into the body cells. Now, we are going to focus more in terms of the type 2 diabetes here, because type 2 diabetes is the lifestyle related. Because of a bad lifestyle, type 2 diabetes is the result of such a bad lifestyle. So let's talk more in terms of the most common lifestyle induced diabetes, which is type 2 diabetes. Now, what is diabetes? Suppose you've eaten a banana or something carbohydrate or rice, for example. It is actually broken down into its basic constituent, which is glucose. So multiples of glucose is what a carbohydrate is. So carbohydrate is broken down into its basic constituents, which is glucose. This glucose gets into the blood, and this glucose gets absorbed. This is the metabolic pathway of in terms of how a carbohydrate is absorbed, digested, absorbed, and assimilated. Now, the hormone, as I earlier said, which plays a role here, is insulin. Think of it this way. Think of an almirah at your home, and you have to open that almirah and to keep clothes inside, and you have a key which locks and opens the almirah. In this example, think of almirah as the body cell. The key that you have is the insulin, and what you keep inside the clothes is the glucose. In this example, think of this lock of the almirah being a little rusty. It's gotten rusty, and you have the key with you, but it's rusty. Now, because it is rusty, even though you have the key, it will take you a little longer for you to open this almirah to keep the clothes inside. This is type 2 diabetes. Body has insulin, it is producing insulin, but the insulin is not able to bind with the cell so that the cell can open and absorb glucose into it. This is insulin resistance or low insulin sensitivity. This would lead to the blood glucose levels increasing because cells are not able to absorb and uptake it. This is type 2 diabetes, right? So in this scenario, just deciding that, oh, I'm not going to wash my clothes. Only if I wash my clothes regularly would I have to even think of opening the almirah. The clothes will not obviously lie down outside or will not get heaped up outside the almirah, right? That's true. So similarly, I'm not going to eat carbohydrate or I'm going to reduce carbohydrate is not going to really solve the problem here because the lock is still rusty, right? For sure, you can make sure that the blood glucose level will not increase, but insulin sensitivity need not have increased in a dramatic fashion just by reducing carbohydrate. The same way, if you're adding a lot of fiber and protein and managing the glycemic load of the food, obviously, if you just take one bowl of white rice, for example's sake, let's let's assume 100 molecules of glucose came in just 2 minutes, for example. But if you're adding a lot of fiber, say a lot of fiber-rich green leafy vegetables and some protein along with that white rice, that 100 molecules of glucose would come in another 10 to 15 minutes. So body is getting a little more leeway to absorb that glucose, right? That's what is glycemic management. Again, the lock is still rusty, the body is still resistant to insulin. That has not improved significantly, right? So dietary interventions in terms of reducing carbohydrate or adding fiber and protein are important. I'm not saying it's not important. They are very integral part of managing diabetes, but please understand that it only allows you to buy time. That's where the importance of exercise comes in. Now, exercises. There are 3 types of exercises: cardiovascular exercises, weight training or resistance training exercises, and yoga. Among these 3 exercises, weight training has a better edge or an advantage while managing diabetes. Why? Weight training is an exercise which involves resistance across muscles and it facilitates muscle growth, also known as muscle hypertrophy. Now, muscles store inside it glucose in the form of glycogen. For a normal healthy adult, the amount of glucose which is stored inside this muscle would vary anywhere from 300 grams up to around 500-600 grams of glycogen being stored inside it. Now, if a person is doing weight training and improves the muscle quality and quantity, the muscles will now be able to absorb more glucose from the blood and probably hold another 50 grams extra, right? So this is how you improve the glucose utilization. So if you do exercises, body will be able to absorb more glucose from the blood because it now can hold more glucose. And there are also a lot more other physiological things such as increased calcium levels in the intracellular levels. All these things will facilitate body's ability to absorb glucose from the blood. Going a little more technical, I hope this gets explained with you will understand it with the video that I'm going to show, animation that I'm going to show along with this. There are certain GLUT4 vesicles which facilitates the absorption of the glucose from the blood into the cell. So these GLUT4 vesicles are located inside the cell, and these GLUT4 vesicles has to go up and gets attached to the surrounding or the periphery of the cell membrane, facilitating a small path which will allow glucose to be absorbed or for glucose to pass into the cell, right? So exercises will facilitate these GLUT4 vesicles to go and get attached to the membrane, outer membrane of the cell, thereby facilitating the transportation of the glucose into the cell and thus bringing down the glucose levels in the blood. So exercises is how you actually, in a way, I would say reversing diabetes. It plays a role there. So dietary management, I would go and say that dietary management is about managing diabetes, very important, but exercise is where when you actually improve insulin sensitivity, to that extent, I can even say that as a diabetes reversal. Now, when I say diabetes reversal, technically the right word to use is remission, but what I mean by reversal is that suppose if you do this kind of lifestyle change with proper weight training and exercise and scientifically approached lifestyle change, you probably might be able to reduce your metformin from 1000 to 500. Of course, this decision has to come from your endocrinologist. You are not supposed to self-medicate, and it's not a decision that is taken by any dietitian or an exercise expert. It has to be prescribed by your doctor. But if that happens, can we not call that as a 50% diabetes reversal, right? You reduce the medicines by half. Not only are you reducing the medicines by half, you are preventing the future complications of diabetes, which can impact eyesight, which is retinopathy. It can impact nerves, which is neuropathy. It can impact the kidney, which is diabetic nephropathy, so on and so forth. So you are not only going to make sure your blood sugar levels, your HbA1c, 3-month blood sugar level is under control, you're also making sure that future comorbidities and chances of complications are reduced significantly. So this is how the lifestyle change has to fall in place with regards to diabetes. The third important factor is sleep. If your sleep is not proper, go check your fasting blood sugar the next morning, it will be elevated. So sleep plays a very important role. With stress, the cortisol levels will increase. With lack of sleep, the same thing will happen. The body will retain blood glucose and blood glucose levels will be higher. So these are the 3 things, and exercise plays a very important role in improving insulin sensitivity for this reason.